So what are some of the challenges of having to work with referral practices?
When you're asking that question, is that working at a specialty hospital, that referral practice, or the relationship between those sending the cases?
I think those sending the cases.
I think that's where we're coming
because
from.
we're always like trying to be better. Okay, what things can referral practices do to enhance the relationship, or to
what can we do to lessen the load for them as well?
Okay,
so what do you think are some of the challenges that
that's a really good question. I'd like to hear the opposite as well from your perspective. I'd probably put it in 3 different categories. One, the appointment, or everything that happens prior to the appointment and appointment day. Second would be like the procedure, at least for surgery, the procedure itself, and then aftercare. So challenges some are out of the control of referral practices, and that has to do a lot with clients. Many times they see multiple veterinarians. And so the information that we receive for an appointment may be incomplete or may not have all the hospitals that they visited. And so I think one of the challenges, not unique to just referral practices, is communication and paperwork.
Mm-hmm.
Makes
I mean,
sense.
if I was to critically examine my own paperwork, it's probably incomplete at times. And so is anybody else's.
Right.
And so there are expectations with each case that you have for me to meet. And it's hard to read between the lines what those are sometimes. So I guess one, incomplete information might be, and then I'm expected to handle that or figure out the problem and then try to solve the problem. And I look at each case having 2 clients, like the person that's holding this companion and then you as the referral partner themselves, because I want both to be happy.
Yeah.
And I'd like to say that we do well with that most of the time.
Oh, yeah.
Yeah. Oh, absolutely.
So that'd be one. I guess procedural wise, sometimes I'll go in a direction that's a little bit different than the referral hospital was thinking, and they've counseled well with clients. And I have to say, this is something that your hospital does quite well. Having seen a number of cases come from many different hospitals, I think All-Star Veterinary Clinic does an awesome job of client prep and case management. So throw that out there.
Well,
Thank you. That's actually really
and it's not just because
encouraging
we're
to hear.
on here, but it's just because it's a true statement, and you can tell that there's a lot of work that goes into that. Probably the last part is follow up, and you don't want to have something go out of the hospital and then assume, the referral partner is going to take care of everything, or I'm going to take care of everything. And so the communication there can be sometimes difficult. If I want to get a hold of you, you're busy just like everybody else and can't jump on the phone right away. And so sometimes things can get lost in translation that way. But I'd say for the most part, that process is not poor.
Nice.
Yeah. I would agree.
Yeah.
Yeah.
I would say from the opposite perspective, I think there, at least me personally, always has a subtle fear of like not educating the owner well enough before sending, and then not meeting their expectation in that regard. So then they're frustrated by the, if you're going a different way or explaining it differently than what I could do, then, I feel bad because I'm not meeting my duty as the referral. So I think that's always in the back of my mind when I discuss referral to any specialty is like, okay, can I go through all the possibilities that would be presented in front of the owner so that they're not blindsided? And then like, what the heck by the time they get to you? I think that would be my biggest.
From my point of view,
thing.
I don't think you need to, though.
Yeah.
You can just tell them, and I think it's okay to say, I don't know.
Yeah.
I think we're often afraid to say, well, I'm really good at, a couple of these things. This is a little bit different. This is why I think we should seek a referral opinion. And they may go a different direction than we've talked about, and be okay with that.
Yeah.
They may want to repeat something, they may not. And you don't really have to explain all the differentials.
Yeah. No,
And so I'd probably take some pressure off of yourself in that regard. Just say, this is why we're going to see somebody different, to see if we need to go a different direction.
Yeah. No, that's good advice. It's encouraging.
Yeah.
I guess one other thing I'd say too, and not so much maybe here, but other or newer, it's okay to refer. And so if you find something a little out of the ordinary, you don't feel like you have resources and other people that can help. Mm-hmm. And so it's kind of a plug for an early referral. Mm-hmm. If we choose not to do something, that's okay.
Right.
Choose to wait.
Well, that's what I always tell people is that just because you go doesn't mean you have to do, and just go and get the information.
Yeah.
It doesn't commit you.
Right. Yeah.
But it gives you information to make an informed decision.
Yep. Yeah. Mm-hmm. Yeah. It's very helpful.
Yeah.